As the coronavirus continues to sweep the country, New York City remains one of the areas most affected. A surge of patients left many hospitals understaffed and overwhelmed. But one UAB doctor saw this as an opportunity to answer the call to help. She tells us about her experience.
I think what surprised me was what a personal toll it took on me. Going in, it was busy, it was stressful, the patients were very sick, but just dealing with that day after day and having to make decisions based on resources.
After 5 weeks of treating patients in New York, Winter says she learned a lot during her time there and is honored to have had the opportunity to serve in New York.